funded with Stepping Out in Pink dollars for their funded research time that they have. Dr. Parson is this year, that's new. But their release time to do research is not funded by Stepping Out in Pink.
Well, I'm not saying like Dr. Diedrich, like as her research isn't, but she was just talking about her patients really, and that side of it.
So maybe if I explain a little bit how the funding works, it might help you decide on how to frame a question for me.
Yeah.
So there's the Gillette Fellowship that's funded through Stepping Out in Pink that funds a full-time FTE in Dr. Kenny's lab. It's a PhD research scientist that does breast cancer research at the bench level. And then the rest of the dollars are put into the oncology, more of a general fund that we tap into for breast cancer research needs. And so some of it offset the clinical research coordinator team in hematology oncology research this year to help provide support programmatic expenses that allow us to provide clinical trial opportunities for our patients that have breast cancer. I mean,
so
other cancers
exactly
too.
What I want you to say.
Okay.
So just kind of just describe what those dollars do.
Okay, so they do a number of things, but that's probably one of the biggest things that we use it for. So supporting Megan's job and then this.
Yes. So we're gonna say that again, like when we're recording now.
I'm already recording.
Oh, okay.
Oh, fantastic. So you want me to talk to both of those points or just the?
Yes,
okay.
but I'm gonna have you start by saying your name and your title and how long you've worked here.
Okay.
Hold on.
Just
noticed
kidding.
one piece of hair that is misbehaving, so, and you're gonna look at Tia.
Okay.
Perfect.
Eye contact. Yeah, so my name is, I work blah, blah, blah for this time.
Okay. My name is Vicki McHough. I'm the Administrative Director of Medical Research at the Gunderson Medical Foundation. I've been at Gunderson for 28 years, and 18 of them have been in the research department.
Also, it's very hard for me not to give verbal, like, cues that I'm listening. So if I'm like, that's because I'm like, I want to go, yes. Okay, so now describe that overview of Stepping Out in Pink, so what you just talked about.
Okay, so the Stepping Out in Pink dollars are used in the research department in a number of ways. So the most visible ways are the Gillette Fellow sponsors a full-time researcher position in the Compare Cancer Research Institute. Megan Gertman is our current Stepping Out in Pink Fellow, and the primary focus of her job is doing breast cancer research at the bench level that we will hopefully be able to translate into patient care down the road. Another section, a large section that the dollars are used to support is we have a clinical hematology oncology research team, and it supports the programming. Oh God, I'm going to start over with the clinical research piece. It is. Okay, so another large section that the dollars support is our hematology oncology clinical research team. So this team is embedded within the oncology department, and their role is to help support our providers in providing clinical research opportunities for our patients. So patients that are interested in participating in clinical trials that focus on breast cancer research, this is the team that provides support to our providers and the oncology staff to be able to have those opportunities here for our patients to participate in here on the local level, so we don't have to refer them out of system.
Beautiful. What does Stepping Out in Pink mean to the research department? Very big question.
It is a big question. What does it mean to the research department? I don't want to say, well, it's money for us to spend.
It's opportunity.
I know,
given that might not be there.
It's a huge opportunity for us to fund programs and research that we would not ordinarily have. And if you've been following some of the news that have been out the last several years, our research teams have done a fantastic job of being able to develop and publish research that makes a difference on a patient level in oncology.
Beautiful. So you kind of already described the where the dollars go in that pipeline of things, so we're going to skip over that question. Why is Stepping Out important to you?
Well, Stepping Out in Pink is important to me in a number of levels. My grandmother, I got to start that over. Stepping Out in Pink is important to me in a number of levels. My grandmother was diagnosed with breast cancer in the mid-'80s. She did have successful treatment for that, but I've also, when I first started working in the research department, my first role was in oncology. I was a clinical research coordinator in the oncology area, and I worked with patients on a daily basis, some of which had breast cancer, some not, but you can see the impact that treatment options have for our patients. And as I've moved up within the department and now, from a manager to a director level, we can do things here better serving our patients and supporting our provider team that we would not otherwise be able to do without these funds.
Beautiful. Why is this event special to Gunderson? And if you could start things like Stepping Out in Pink is special to Gunderson from like a systematic aspect.
Oh, I don't know, like for the system versus just me, huh?
Mm-hmm.
Well, Stepping Out in Pink is special to Gunderson from a system level, as I think that there isn't an event like this anywhere else. Normally, fundraising events like this, they have fantastic big splash in the beginning, and support kind of wanes over time. But our community here is so exceptional. We've been able to maintain and increase support well over 15 years, which is almost unheard of in events like this. And I think that speaks not only to our community and how generous they are, but the belief and the support the community has in us and being responsible with the use of the funds that they've so generously given us.
You're doing great.
Yeah.
This is awesome.
easy.
This is really easy. So speaking on, the generosity of the community, why do you think that the community continues to choose Gunderson and support us?
Everyone has their choice in healthcare, and the focus that the Gunderson Health System has chosen to move forward with is based on our community and what can we do to help improve the community and the health of the community as a whole. And I think that that's different than a lot of other systems, and the decisions that we make at the leadership level are greatly influenced by that. And I think that our community population sees that, and when it comes to a choice, if you're able to select your health care, I think that's attractive, especially for a lot of our younger generation.
What would you say to others to encourage to make a gift or participate in Stepping Out in Pink? Do it.
Stepping Out in Pink is a fantastic opportunity to support the community and healthcare at a local level. I think, cancer has touched everyone's lives in one way or another, and breast cancer is the most... Oh, I have to start all over because I can't think of the word I wanted to say. Okay, how did I start this now? Tell me the question again.
Yes. What would you say to encourage others to make a gift or participate in Stepping Out in Pink?
Okay. I would encourage people to participate in Stepping Out in Pink, or if you're not able to, donate. It provides funding here for our patients at a local level. Oh my God, I gotta start again. I totally lost my train of thought.
We're hyping you up too
I
much.
know, I was doing too good. Okay, tell me the question one more time.
Okay.
How
What
would
would
I
you
say to them?
Yep, to encourage to make a gift or participate in Stepping Out in Pink.
Okay. All right. I would encourage people to participate in Stepping Out in Pink, or if you're not able to please make a donation. The money stays here locally, and it supports our local patients and our providers, but also we're doing things here that are exceptional, that aren't happening other places. And I think it's fantastic that we have the community support to continue to pursue those avenues where someday we can hopefully find a cure and eradicate this terrible disease.
What is one thing you wish everyone knew about Gunderson Medical Foundation? So this is kind of this broader question here.
Oh, geez, the foundation or the research department?
You could say, well, technically the research foundation or research department is in the foundation. So yeah, you could touch on, you wish more people knew that the research department was included in development and education.
Oh, that's a good point. Okay.
Highlight your area.
I wish more people realize that the foundation is actually multifaceted. The development team is the most visible component of it that faces our community, but there's medical education, there's medical research, there's resolve through sharing, Global Partners, our grants department. So there's lots of fantastic things that are happening every day. And our research department is actually fairly large and is embedded in multiple sections throughout the institution. So there's lots of opportunity if you're interested in helping support the Medical Foundation to find something that specifically speaks to you.
Perfect. So if a donor was with you today, so this is kind of like, now you've been to Heritage, so like all of the donors are out here. So if they were with you today, what would you say to them? And start this out as, you know, if I was with a donor today, or if I was having a conversation, I would say X, Y, and Z.
About stepping out in pink or just in general?
Just about donors. So it's basically like this end piece is to like make donors feel good of the impact that they've done.
Okay,
And you
so
will
to a,
probably
not
be there,
not to
so.
a potential new donor, but to a current donor.
Current donor.
Okay. All right. All right. So if I was meeting with a donor today, I would like to share with them. Oh crap! Start again. If I was meeting with a donor today, I'd like to share with them the impact that their specific gift has had on how we've been able to promote research here at Gunderson. Every gift is unique. Some are directed towards certain types of diseases, and some are more general in nature, but they're all important and they all make a big difference on how we can do what we do every day.
Perfect. So now you're going to look not at me, but at the camera. So it's going to be looking at the audience now. You're going to say, I'm Vicki, or however you want to, first and last name does not matter to me. And this is why I support Gunderson Medical Foundation.
Okay. I'm Vicki McHough, and this is why I support Gunderson Medical Foundation.
Gunderson Medical Foundation, where your generosity changes lives.
Gunderson Medical Foundation, where your generosity changes lives.
Thank you for supporting Gunderson Medical Foundation.
Thank you for supporting Gunderson Medical Foundation.
Do you have anything else you'd like to add?
No.
Beautiful. That was awesome.
Gosh, I wish every interview could be this easy.
Really? Because it was painful.
No,
No.